Greetings, everyone. Welcome to an important question and answer session about the response efforts to the COVID-19 pandemic here in Huntington. My name is Brian Chambers, and I'm the Communications Director for the City of Huntington. We have two special guests with us on this session today, Mayor Steve Williams and Dr. Michael Kilkenny, who is the Physician Director for the Cabell-Huntington Health Department. Earlier this week, we did solicit questions for this question and answer session from the public, and we will be answering some of those questions. I just want to remind everyone, though, watching this, that as we go through this session, and if there is a question that is not addressed, there are some resources out there. The first of those is the Cabell-Huntington Health Department's COVID-19 information line. And that number is 304-526-6544. Now, keep in mind that number is open Monday through Friday from 8 a.m. to 6 p.m. For after hours, the West Virginia Department of Health and Human Resources, they have a hotline as well, and that number is 1-800-887-4304, and that is a number that is 24/7. So before we actually turn to the questions, I want to give Dr. Kilkenny and Mayor Williams each just a couple minutes to discuss an update on their operations as it relates to our response to this pandemic here in Huntington and also in Cabell County. So I will turn it over to Dr. Kilkenny first to let him provide his update. Dr. Kilkenny?
Hey, thanks, Brian, and thanks, Bullseye. Thank you, Mayor Williams, for inviting me to talk with you this afternoon. I wish that we could meet in person, but it's especially important right now that we do what we're asking other people to do, and that's distance ourselves in person, but still support each other. We're at a time when this pandemic is arriving here. With cases in counties that touch ours, with travel back and forth, business, work, or healthcare, we have to realize that the virus is in southwestern West Virginia and in southeastern Ohio. We don't have to travel to Seattle or New York to be exposed. This virus has been or is in Huntington. Now's the time we've been preparing for. This is why we've been talking about washing our hands, disinfecting surfaces, keeping our distance and staying home when we're sick, staying home to work if we can, and taking extra care when we go out. I am certain that we will have a case in Huntington.
All right, Dr. Kilkenny, thank you very much for those comments. Mayor Williams, I'll now turn it over to you for your brief update.
Thanks, Brian and Dr. Kilkenny. It's good to be able to be with you, albeit in different places. But once again, this isn't unusual. We're always working with one another, and want to publicly thank you for how much you help us in the decisions that we're making on a daily basis. I was talking with my staff earlier about how we are moving forward in dealing with the COVID-19 pandemic. In a sense, what we're doing is that we're not making a single decision based on politics and certainly not on economics. We're making all our decisions based upon science. And that's why I stay in touch with Dr. Kilkenny. That's why I stay in touch with folks at Marshall Health and at Mountain Health, at Valley Health, other healthcare providers throughout the state, so that they can tell us what we're doing. So just this week, the governor placed an order of being shelter in place, making sure that we stay at home, that only essential businesses are actually are able to continue. The shelter in place, in one regard, is to help lessen the curve, to flatten the curve, as they speak about in all of the media events. But there's another reason too. It's also to protect our healthcare providers, also to protect our healthcare system. Because understand, if you find yourselves being exposed to the COVID-19 virus, and then you expose it to someone else, imagine those individuals who are going into work, understanding that those nurses, those doctors, other healthcare providers going into work at the beginning of the day, and they're wondering, am I going to catch that virus? We need to protect them as well. And you have a lot of very insightful questions, and I'm looking forward for us to have a chance to talk about this. But please understand this, is that what we are encountering right now is something that has never occurred in the United States. It's all 50 states, all 50 states. And there doesn't seem to be any relief in sight. So the brutal facts are, it's coming here. As Dr. Kilkenny said, it's probably already here. What I'm fearful of is the surge. What I'm not fearful of is how this community can respond. We're prepared for this. And I'm looking forward to answering your questions.
Mayor Williams, thank you very much. So now we dig into the questions. And the first question is for Dr. Kilkenny. And Dr. Kilkenny, this is an issue that we've been seeing a lot on the national news. The acronym PPE is an acronym that we've all become familiar to over the last couple of weeks. And that is in reference to personal protective equipment. That's gowns, goggles, masks, gloves, and whatnot. So the question that I have for you is, how do you get PPE? And if you could elaborate on that as it relates to both the average healthcare worker, but also members of the public.
Yeah, that's a great question, Brian. PPE is especially scarce right now. And personal protective equipment is essential for healthcare workers. And we've got several ways that we are getting the PPE to the healthcare workers. Let's start with that. First of all, our healthcare workers and our healthcare agencies have some small stores of PPE at any given time. We use PPE on a regular basis, but we never use it at this kind of pace. So those supplies, if they aren't gone, they are very close to gone. And we've been working to resupply. There are some PPE supplies that can still be purchased. Most of them are on back order. It's really difficult to get. And so we made a request, and the other agencies have made a request through the state's health command to the Strategic National Stockpile. And we've been issued a supply of PPE that we are to distribute. The health department is in that distribution chain. It comes to the state of West Virginia. They decide who gets it. They send it to us, and then we deliver it locally. And we really don't have any say in who gets it. They decide who gets it, and then we send it out. So we have gotten in 2 shipments already. The first one was very small. The second one was bigger. And we are hoping for more shipments, but we can continually feed up the chain for the Strategic National Stockpile. And we are getting some of that. That is also supplementing the things that they can get through their usual supply lines. As manufacturing picks up again and that becomes more available, I hope that will, the strategic stockpile will bridge that gap so that we never run out. But We have contingencies if we do run out, even down to the point of homemade masks or wearing, tying a bandana around your face that's last resort, but that's what we'll do if we have to in order to get people taken care of. It's a special problem for people who in their household have somebody who is immunosuppressed or who has severe medical problems such that introducing the disease to that person would be especially dangerous. Getting PPE in the home can be especially hard. Most of the suppliers are out. You can still get surgical masks or surgical style masks and even some N95s at hardware stores, at the big box stores. They're made for construction, but they can be purposed into healthcare in situations like this. And if it's not possible to get anything, then there are ways that are listed online to make PPE at home, or to certainly cover your face with some kind of a cover. And it really helps with cough etiquette and stuff like that. And N95 masks are really not recommended for home use anyway. So the lower level masks, if you can get them or if you can make them, can help keep you safe until the supplies get more plentiful.
All right, Dr. Kilkenny, thank you so much. The next question is for Mayor Williams. This is actually a question that we received from the public, from a Michael Stinnett of Huntington. Mayor, Michael was asking, how is the city preparing its first responders for COVID-19?
Thanks for the question, Michael. What we started a few weeks ago, we had the National Guard come in and provided training for our police officers, our firefighters, even our public works workers, and our water quality board workers. They provided extensive training as to how to be safe, how to make sure that that we're able to maintain a distance from individuals as we're out on our jobs, and have been able to proceed forward with that. Dr. Kilkenny was just talking about some of the protective equipment that individuals are needing. We had a vendor that provided to us N95 masks for all of our police officers, our firefighters, and our EMT workers. In turn, the Department of Military Affairs and Public Safety provided enough masks, N95 masks, also for police, fire, EMT, and every police, fire, and EMT within Cabell County. They provided over 1,400 masks, N95 masks for the area. I talked with Secretary Sandy of the Secretary of the Department of Military Affairs and Public Safety. I talked to him today, and he has emptied out his warehouse to all of the first responders in the state of West Virginia, is looking for additional masks. Now, every one of our first responders are going to have one mask, that's at least one mask that's been given to them, and they do have a shelf life, and we're going to have to replace them. And I'll be talking later on about the efforts that we've been making to make sure that additional equipment is being received in the area.
All right, Mayor, thank you. Next question is for Dr. Kilkenny. And Dr. Kilkenny, this is another big issue that we've been reading and discussing, even among family and friends, and and that is the question about testing. Please explain to us what is exactly the testing process, but also what are the guidelines to get tested? What are the criteria to get tested?
Sure, that's a question that we get a lot too. First of all, I have some good news on that. Testing is becoming more available. The testing restrictions are lessened, but the supplies are still limited, and so we are prioritizing testing now. The testing is actually a decision that's made between the patient and their provider. So a person to get a test is going to talk to their healthcare provider or go to a test site, which usually then involves talking to a healthcare provider to decide whether a test is appropriate for them, also to see if testing is available for them. And if the testing is really hard to get, they'll follow a set of criteria or really priorities in order to determine if that's going to be what we end up doing. Those priorities I happen to have here because I look at them frequently, but I'll just go right down them. Priority number one is for hospitalized patients and for healthcare facility workers with symptoms. You'll see that all these priorities are for people who are sick. The priority number two is for patients in long-term care facilities that have symptoms, patients over 65, patients with underlying conditions, and first responders. The third priority is for workers in critical infrastructure or individuals who don't meet any of the above categories who have symptoms. Healthcare facility workers and other first responders are down in this character or down in that priority also. And individuals with mild symptoms in communities that are experiencing high numbers of COVID-19 hospitalizations fall under that. Individuals without any symptoms might be able to get tested, but they are non-priority. There's no priority listing for them.
Okay. Dr. Kilkenny, thank you. Mayor, next question. We know that city government's main priorities are police, fire protection, paving roads. And we don't have a direct role in the city government does not have a direct role providing the expansive healthcare services that we see in this region. But we also know right now that we are seeing a lot of stories across the country where healthcare providers are truly struggling to get personal protective equipment that they need to combat this virus. In that regard, what role do you think city government should play to advocate for their needs?
It's an interesting question, Brian. This was something that I faced 7 years ago when I first came into office, is that there's a responsibility naturally for a mayor to run the day-to-day operations of the city, police, fire, making sure potholes are fixed, sidewalks are fixed, trees are cut down, running the city. But I started finding out real fast that that might be the responsibility of the mayor of the city, but there's an even greater responsibility as mayor, and the voice goes well beyond the city limits. What I came to understand is that the issues that are directly affecting our city are not necessarily just limited to our city. If what happens in Ohio, what happens in Kentucky, what happens on deep into southern West Virginia, up Route 2 and up towards on up the Ohio River, those things are affecting us. And to that effect, I have a responsibility to be the voice, and a strong voice for the citizens of our community, for our healthcare workers. Our healthcare workers are in the midst of a war right now. And being in the midst of that war, they have to be given the equipment to do what they are doing. We expect that our police officers be given the proper equipment to do what they have to do to keep us safe. Our firefighters have to be given the proper equipment to do what they do to keep our property safe. Well, the doctors, the nurses, all of the healthcare workers also have the responsibility, need to have the proper equipment to be able to go forth on this. And the problem that we have right now with this pandemic is that we don't see it coming. And when they go walking into the emergency room, when they're going in and they're exposed to other individuals, they're in the midst of a battle that we don't see the enemy coming. So I've been in touch with the leadership of the hospitals, of the healthcare clinics, Marshall Health, Valley Health, other clinics within the community, hospice and others, to try to identify, all right, just what are our needs within the community? Every one of the organizations that I've just mentioned are actively working to make sure that they have enough supplies and equipment. But the problem is there's a run on it all over the world, and they are out competing to try to get it. So what I've also been in touch with is quite often, as a matter of fact, every Wednesday I'm participating in a conference call with the White House to get an update as to where we are on the COVID-19 virus pandemic. Yesterday, I had telephone conversation with Senator Manchin, this morning with Senator Capito. Yesterday was in touch with the Congresswoman Miller's office. We were in touch with the governor's office, in essence saying that we have these needs and we have put an inventory of needs that we have for this area, not for each individual institution, for the area. And what we were asking is, where can we go? Where is it that I can make sure that we are going to see that we are receiving the equipment that we need so that we can fight this? Fortunately, as Dr. Kilkenny said, it's here, but it's not at the level that it is at other places yet. And my biggest concern is when that surge comes, is that we have to be prepared to do just that. And I have absolute faith, just as we saw with Secretary Sandy, over 1,400 of those masks that were delivered to us. I have faith in Governor Justice and his administration through the Department of Military Affairs and Public Safety, through the National Guard. I also have faith that Senator Capito and Senator Manchin, as well as Congresswoman Miller, will get us in touch with who we need to get in touch with.
All right, Mayor, thank you very much. Dr. Kilkenny, this is a question for you, and this is an issue that we have been this is an issue that we have been hearing about a lot over the past 48 hours or so, since Governor Jim Justice issued his order for everyone to stay at home. In that order, there were some exceptions for essential and also non-essential businesses. So if you could, please tell our audience, what is the difference between an essential and a non-essential business?
Well, the governor's order is long, and so I'll make a short answer of that. The essential businesses are those things like hospitals, like healthcare facilities, like grocery stores, like pharmacies, places that have to operate for the good of the public, and the public needs those. Other essential businesses are trucking and delivery, to make sure that those stores are supplied and also to deliver to home. There's a lot of essential services. Some manufacturing is considered essential, but the list is really long. I'd recommend that people go to the governor's website and see the order. And on his website, there's also a question and answer that can answer the questions about his order better than I can.
Okay. Dr. Kilkenny, thank you. Mayor, I do want to stick on this point for just a minute. Your office has received a lot of calls this week with questions about, what is essential, what is non-essential. The governor's order gives municipalities the enforcement powers to carry that order out. Talk a little bit about what the city has done from its standpoint to ensure that this order is being enforced appropriately.
Well, interesting. This is the governor's order right here. It's several pages long, and this is what was signed by the governor, and they sent us a copy so that we would know what we're dealing with. My office, the mayor's office, immediately reached out to certainly the police department, Cabell County Sheriff's Department, so that we'd be coordinating with them, the prosecuting attorney, as well as the West Virginia Attorney General's office, to create a protocol as to how we would actually move forward on this. And if someone identifies a business that is continuing to operate that they don't believe actually meets the requirements of this executive order of an essential business, all they have to do is call 911, and that creates a very specific document or record of the complaint that this business is operating. And what we will do is that it will be assigned to the police officers, and what those police officers will do is go and actually meet with the business. If the business indicates that they feel that they are operating as an essential business, then we ask them to give us a letter stating within 12 hours, provide us a letter indicating as such that why they feel that they are an essential business, and then we provide that information to the Attorney General's office. We also have worked, as Dr. Kilkenny will attest, we've also consulted with the health department, because even if there are businesses that are considered an essential business, they have certain health protocols that they need to hold in place to make sure there's proper social distancing and such. So we feel that we're in a position now with the protocols that we have, once again, after consulting with the police department, the prosecuting attorney's office, the West Virginia Attorney General's office, the health department, as well as coordinating with the sheriff's office, that for those businesses that are within the city limits, then if there is a complaint, dial 911, then we'll look into it, and then we'll proceed forward.
All right, Mayor, thank you. Dr. Kilkenny, let's turn back to testing for just a minute. Is there a cost to get a test? Do you have to have insurance? Can you get one without insurance?
I wish I knew the full answer to that. The short answer is that we've been assured by the federal government that they're working as hard as they can, that there'll be no cost associated with the test. I want to caution people in terms of the cost is that that test may not be the only cost that would be incurred. There may be preliminary testing to see if there's something else wrong with somebody. So I hate to paint this picture that this is all for free. There may be costs that are associated with this, but the insurance coverage for the test itself appears to be really strong, even copays covered in most cases. The best way to find out and to answer your questions about your testing would be to call your insurer or your physician or your testing site to determine whether there are costs that wouldn't be covered by that insurance.
Okay, thank you. Mayor, the next question is for you, and this is something that we haven't discussed yet, but This is the other half of this battle that we're in right now, and that is the economic battle that we are seeing, not just not just here in Huntington, but also across the country. Talk a little bit about what you and your administration have done thus far to help lessen the blow of this economic impact.
We were talking, thanks, Brian. What we were talking about earlier is that the virus has made its way here, although we don't have any known cases of people who live in Cabell County yet. It's on its way, but the fact is the virus has hit us because businesses are closing. People are being laid off. With the governor's order earlier to close all bars and restaurants, and that restaurants could only be open for carry out or pickup and delivery service, with the most recent order of shelter in place, but also to saying that only essential businesses can operate. It's had a drastic effect already within the city. Shoot, if you're driving around in town during the day, during the times that in the morning when traffic is at its busiest, or in the evening when traffic is at its most busy, in getting home, it's an easy drive. Hardly anybody is out, because everybody is staying either working remotely at home or they're just not working at all. We had a real concern that we knew that we needed to address. So the first thing that we were doing, as much as we were saying everybody needs to have each other's back here, help each other out in whatever ways that we can, doing all the smart things that we can do to make sure that we're not spreading the virus, but help each other out. And that's the strength that we have here in our community. What we realized is that city government needed to do what we could. There are individuals who are just clearly a paycheck away of losing everything. Sadly, we're not the wealthiest community. There's some people who do well, but there is a significant part of our population, of our residents, that are marginalized, that they really are working from paycheck to paycheck. And when that paycheck is gone, they're sitting there and they are at risk. So what we decided to do is that the city needed to see, would there be a way for us to create some tax and fee relief for our residents and for some of the businesses? And as we looked at them and did extensive analysis of how much we could do, what we could do, and what would provide the most effect, we decided to, from April through June, to lower or eliminate the refuse fees of $20 a month to individuals. Some individuals, that might just be a brush off to them, but there are some individuals that can be quite significant. And we want to be able to do what we can, at least to take that away. We're also the most vulnerable of businesses that we have are our retail businesses and our restaurants. And with those, we decided that the business tax that we have, B&O tax, would be reduced to zero. City Council on Tuesday morning at 11:30 has a special council meeting, and they'll be considering those two ordinances, and they should go into immediate effect in April 1st through June 30th. Other things that we're doing, aside from just trying to ease the financial burden as much as in whatever way that we can, we're also have the parking board that has in front of restaurants, so that individuals could come in and get pickup service or the curbside service or carry out service. We have placed no parking or free parking right in front of those businesses as well. What we've also been doing is we found that our restaurants, in some of the delivery systems that they have, the craft beer and wine industry has really made a big splash in the community and has started to grow substantially in the downtown area. And I was approached by some tavern owners owners to reach out to the Alcohol Beverage Control Agency, speak to their commissioner as well as the governor's office to see if there was some relief that might be able to be made there. That conversation went straight to the governor and to the governor's secretaries as well as the governor's staff. That's still being discussed. The Convention and Visitors Bureau is creating a list of businesses that are essential businesses that are able to stay open, and creating a list on their website as to how you might be able to order from them. There are some businesses that their storefront isn't open, but they also have an online presence where you're able to buy from them online. You're able to do that by gift cards and such as that as well. What we're trying to do is find ways to be able to help each other, and by doing these things, we think that this is the one way that Huntington has a leg up on other areas. Whenever we've had difficulty, we have found ways to be able to stand and be able to support one another. It's a different way now because of the need for social distancing and having a stay-at-home orders and such as that. But we can do this. We wanted to set an example in the city, and other individuals are coming up with their own unique ideas, just as Huntingtonians always do.
Mayor, thank you very much. Dr. Kilkenny, this is a question that I've personally seen a lot of on social media and in the phone calls even to our office. Where does one go for testing if they don't have a primary care physician?
Yeah, well, Brian, we certainly recommend people getting primary care physicians so that they can better their access into the healthcare system. But right now in this emergency, there may not be the best time to do that. There's another particular thing that this emergency is doing is it's changing the way doctors' offices are seeing illness. So if you're interested in testing, don't just run to your doctor's office and don't run to the emergency room. Give your doctor's office a call and follow their instructions. If you don't have a physician, then call one of the numbers for the testing sites. Most of the testing sites can advise you as to how to access testing, and they've made arrangements to take care of getting orders for people, even if they don't have a doctor in most cases. Now, if you need to know how to get in touch with those testing sites, go to our web page, which is Cabell Health, one word, cabellhealth.org. And right under our top banner, there's a banner that talks about coronavirus COVID-19 testing sites. So you can click on the box in that banner, and it will take you to the phone numbers and addresses of the testing sites that we know of and that have affiliated with us in making sure that they're doing the testing properly and reporting it properly. There are several good testing sites in Huntington right now.
All right, Dr. Kilkenny, thank you. Mayor, this is a question that everyone is starting to relate to in their own way, and that is, how are we to cope during COVID-19? We see a lot about social distancing and sometimes the isolation that can create. We know there isn't a perfect book or a guide for this because by definition, this is very unprecedented. We've never seen it before. But there are some certain coping skills that can help, and that is the lesson that we have been hearing. talk a little bit about what you've heard about, what are some general lessons that maybe all of our community members could be thinking about or, following as we adjust to this, what has become a new reality here in the last few weeks?
This is an interesting question, and in many regards is the hardest to answer and to resolve, because the behavioral effect that it's having on our mental health is every bit as real as the effect that virus would have if it came and started attacking our body and attacking our lungs. The one thing that I've come to learn in life, and in some of the issues that we've had to deal with here since I've been mayor, but certainly life's lessons have helped. When something extremely unexpected comes or is changing life and changing the routine, what I've come to understand, and I've counseled individuals and I've had to learn for myself, is that you have to find there is something to live for. There is something that is driving you. Everybody has something that they might be able to do. The difficulty is right now with this virus and with social distancing and shelter in place is that we're having to rethink how we go about doing everything. So the one thing is that I would ask you in the most quiet times that you have is give some thought. What's your assignment here? How is this coming upon you and giving you an opportunity to be able to help somebody in a way that nobody else is able to help? And then get into a routine. We are breaking our routines completely. As I indicated at the very outset, I've been on conference calls constantly with the White House and with other mayors around the country. I was just on a conference call just before this, and there were individuals who came on that were from various other cities around the country, but they all had been working remotely. And I'm used to getting on the call with them, and they're really happy to be able to communicate with one another, and you could hear a forlornness in their voice because they don't have that connection to the office, to those with whom they've been working, to that activity that just keeps them wired. So we need to get into a routine. That routine is that just because you're sheltered in place doesn't mean that you're sheltered alone. We still have our phones. We still have the computer. We still have other ways. And it's interesting to see how just the way that we're communicating this right now, when Dr. Kilkenny was clear to tell us we can't sit together and be showing how you can go about doing social distancing and communicating effectively. We can't be doing that in the same room, because if one of us ends up getting sick, then all of a sudden it's placing everybody else at risk. So fortunately, we live in a day of technology where we're able to communicate with one another, and there are unique ways to do it. So it can be Facebook, it can be Twitter, it can be through Zoom or through FaceTime Live or whatever some of these are called. We can stay in touch with one another. The one area that just breaks my heart is that we have seniors that are living in senior homes, personal care facilities, and those are locked up tight. My mother lives in a senior living facility, and it has been locked up. We talk, but I haven't been able to lay eyes on her for 3 months. That's hard. That starts to eat at you. So my brother and I are trying to find unique ways. My wife, Mary, and I, we're all trying to find unique ways to be able to communicate. But the most important thing is that what's right for you, it doesn't necessarily mean it's wrong for someone else, or what's wrong for you doesn't necessarily mean it has to be wrong for someone else. Find what's right for you. Do those things. If watching the news, keeping up with what's happening helps you, then watch the news. If watching the news starts to create anxiety, then find a wonderful book. Shelter in place does not necessarily mean that you can't walk out into your yard. Shelter in place doesn't necessarily mean you can't work in your yard. Heaven knows, with this weather, I'm looking forward to this weekend actually working and finally mowing a lawn, being able to go out and do some weed eating. What I would encourage, though, if you go to the park, please be careful. We're seeing so many people there. You have to exercise social distancing there. If you're going, there are people who are type 1 diabetic. There are people who have heart conditions or lung conditions. They're scared to death about someone else. Let's not be so dependent upon that. I'm proud that I am able to do this because I'm a free American. Well, yes, that doesn't necessarily mean you're right. Let's do what we can to make sure that we're watching out for one another. Main thing is to identify those things that you can do so that you can cope. And with that, all that I would continue to say is that just be safe, be careful. And as someone quite wise said to me when they noticed that I was starting to feel anxious, they said, "Breathe, Steve, breathe." That's what I've come to understand, the coping skills that I've been able to utilize in the midst of all of this tension and these uncertainty times that are around us.
Mayor, thank you so much for that lasting message. And with that, gentlemen, thank you very much. It's been a pleasure talking to both of you. I think there was some good information that was shared with the public today. One last reminder, though, to the public and to anyone watching this, if you have a question that we were not able to get to, that we were not able to address, please keep in mind that there are two very good resources for everyone out there, not just here in Huntington, not just in Cabell County, but in the entire state of West Virginia. For residents of Huntington and also Cabell County, we have the Cabell-Huntington Health Department COVID-19 information line, which is 304-526-6544. And again, that information line is staffed Monday through Friday from 8 a.m. to 6 p.m. And we also have the West Virginia Department of Health and Human Resources hotline. Now, that is a line that is staffed 24/7. That line is 1-800-887-4304. So to close out, just in summary, please continue to follow all of the recommendations that you see in the news and on social media. Please continue to wash your hands regularly. Clean countertops frequently. From an economic standpoint, support local business as you can safely. Go online and shop. Call and order out and pick up your dinner curbside for many of our local restaurants. Do what you can to support our local community. And lastly, but most importantly, stay home if at all possible. Exercise social distancing if you must go out, but stay home as much as possible. With that, thank you very much. We hope our entire community stays safe, and we will be coming back to you with regular updates. With that, thank you very much.